For stroke, in an easy way, the simple mnemonic is be fast. B stands for balance. If you regularly have problems with your balance, social media primarily targets three centers of our brain, which causes the problems that it is causing these days.
নমস্কার। রুবি জেনারেল হসপিটাল অ্যান্ড রুবি ক্যান্সার সেন্টার আয়োজিত এই বিশেষ পডকাস্টে আপনাদের প্রত্যেককে স্বাগত জানাই। আমি রয়েছি আপনাদের সঙ্গে আজকের এই পডকাস্টটির সঞ্চালনায় সৌরদীপ। আজকে আমরা কথা বলবো আমাদের মাথা বা ব্রেন নিয়ে। বাঙালিদের মগজাস্ত্র, আমরা প্রত্যেকেই জানি সেই মগজাস্ত্র ব্যবহার করে বাঙালি পৃথিবী জয় করেছে। শুধু বাঙালি কেন, সারা বিশ্বেই এই ব্রেন বা আমাদের মাথার ভিতরে যে অংশটি, তাকে নিয়েই এত মাতামাতি। আমি পডকাস্টটি শুরু করব আমেরিকান কবি এমিলি ডিকিনসনের একটি কোট দিয়ে। দ্য ব্রেন ইজ ওয়াইডার দ্যান দ্য স্কাই, ফর পুট দেম সাইড বাই সাইড, দ্য ওয়ান দ্য আদার উইল কন্টেন উইথ ইজ অ্যান্ড ইউ বিসাইড। এই মাথা নিয়েই আমাদের এত যখন মাতামাতি, সেই নিয়েই না হয় আমরা আরেকটু বিশদে কথা বলি। এই নিয়ে বিশদে কথা বলার জন্য আমাদের সঙ্গে আজকের পডকাস্টে রয়েছেন রুবি জেনারেল হসপিটাল অ্যান্ড রুবি ক্যান্সার সেন্টারের কনসালটেন্ট নিউরোসার্জন ডক্টর বিপ্লব সিং। স্যার, ওয়েলকাম টু আওয়ার শো।
Thank you.
Sir, the first thing that I would like to ask you in this podcast is, what are the three most important things that people can do to keep their brains healthy?
The three most important things that, according to me, are, as per science, very healthy diet, good nutrition, daily moderate cardiovascular exercise, and an interrupted good 7 to 9 hours sleep on a daily basis.
So moving on to the second question, it's generally the notion, as the common notion goes, that we look after our heart, we look after our liver, we are conscious about our GI system, but often the brain health gets neglected, though it's considered to be one of the most important parts or organs of our body. So sir, trailing to this, my next question would be, at what age should people start thinking seriously about brain health?
I'd say that every age is important. This should be started from the very beginning. But in our Indian lifestyle, I'd say around the age of 40, that is the precipitous moment after which we should be conscious about our brain health. We have to be deliberate about how to take care of our brain. Just like our heart, our body, the brain also needs care.
Okay. Sir, as per the bandwagon goes, everyone is going to the gym now and training their different body parts. Can the brain be trained in relation to this, or how much important is it to train our brain?
It's very important to train the brain, but training the brain is not a specific exercise per se. It's a culmination of your daily lifestyle and your living habits. I'd suggest that leading a moderate lifestyle, as in having a daily brisk walk, a daily simple cardiovascular exercise like cycling, swimming, keeping yourself mentally active, reading, writing, debating, solving simple crossword puzzles, eating healthy almonds, fish oils, communicating with your social society that you have around you, getting a good rest, avoiding social media, staying off technology, avoiding the calculator for simple calculations, basically keeping your own self active as much as possible. It goes a long way and it all adds up on a regular basis. There's no specific thing that needs to be done. In fact, we need to do less, rely more on our own body.
তার মানে দর্শক বন্ধুরা, আমরা বুঝতে পারলাম যে আমাদের মগজাস্ত্রে শান দেবার জন্য কিন্তু অনেক রকম পদ্ধতি আছে, যেমন রেগুলার এক্সারসাইজ করা, বেসিক কিছু ক্যালকুলেশন, যার জন্য আমরা হয়তো ক্যালকুলেটর বা মোবাইল ফোনের ওপর একটু বেশি মাত্রায় নির্ভরশীল হয়ে পড়ছি। তার উপরে নির্ভরশীলতাটা একটু কমিয়ে আমাদের ব্রেনকে সেইভাবে ট্রেন করা, যাতে ব্রেনও আমাদের সেইভাবে সাথ দেয়। আমি এবারে আরেকটু সিরিয়াস একটা টপিক, যেটাতে আই উড লাইক টু মুভ অন, দ্যাট ইজ ব্রেন স্ট্রোক. That is a very deadly thing that can be fatal for a human being. What are the warning signs of stroke that a commoner should know and be prepared accordingly?
For stroke, In an easy way, the simple mnemonic is be fast. B stands for balance. If you regularly have problems with your balance, you need to be worried. If you develop any eye signs, then that is a cause for concern. Facial deviation, weakness in your arms, any difference in your speech. In all of these things, we need to be very concerned. And the most important thing in stroke is that it should not be ignored. As soon as possible, you should visit your health practitioner and get yourself evaluated. So it is be fast, balance, eye, face, arms and legs, speech, and time. So that is the mnemonic, I'd say. That's most important for a general public to understand that these are the warning signals for stroke.
So as you have highlighted the warning symptoms or the warning signs of a stroke, being a family member of someone who is getting onto the verge of having a stroke, what should he or she do to prevent him from going into such a fatal cycle or fatal vicious cycle of stroke?
At home, the first thing that we should do is ensure that the patient is not smoking. Smoking is the most deleterious aspect that affects brain health. Second to that, optimize the cardiovascular health of the patient. We can regularly monitor the BP, and if the patient has hypertension, we need to aggressively manage that. These two things can be easily done in any home setup. And third, obviously, we have to visit a professional neurologist or a neurosurgeon and start the required treatment as per the hospital.
তার মানে দর্শক বন্ধুরা, আমাদের এই যে একটা ভয়ানক যেটাকে আমরা ভয় পাই স্ট্রোক বা ব্রেন স্ট্রোক স্পেসিফিক্যালি, সেটাকে আটকানোর জন্য আমাদের কিন্তু আমাদের জীবন চর্চাকে সেইভাবে পরিবর্তিত করতে হবে, স্মোকিং থেকে দূরে থাকতে হবে, আমাদের রেগুলার আমাদের ব্লাড প্রেশার মনিটরিং করতে হবে এবং অবশ্যই বিশেষজ্ঞের পরামর্শে আমাদের সর্বদা থাকতে হবে যাতে এই ধরনের কোনো মারণ ব্যাধি থেকে আমরা শতহস্তে দূরে থাকতে পারি। স্যার, ট্রেলিং টু দিস টপিক, I would move on to another very common problem that regardless of age, regardless of social stature, everyone is facing nowadays is a problem of a persistent headache and migraine. So sir, when a headache should be treated as just a headache and when should it be not? When we should treat it as an alarming sign that the headache is no more just a headache, it's something beyond that and we need to think on it.
Okay, headache is a common symptom, and yes, this is a very valid question because most of us go through this in any part of our lives. See, headache that is not resolving on regular medications or analgesics for more than 5 to 7 days, or headaches associated with secondary symptoms. Now, what are the warning secondary symptoms? Headache associated with vomiting, headache associated with loss of consciousness, headache associated with dizziness, headache associated with deviation of the face, weakness in one side of your body, headache associated with excessive dizziness. These are symptoms that suggest that the headache could be a migraine, or very rarely, God forbid, it could be even more, it could be a tumor, it could be a transient ischemic attack, which is a harbinger of stroke. So whenever most of us for a headache we take a paracetamol tablet, 2, 3, 4, 5 days is justified. Beyond that, if even after medications we are feeling that something is off, it's always prudent to visit a specialist.
As you have highlighted the symptoms, would you like to mention some deadline that a commoner should follow, like when he or she should visit a clinical physician?
Yeah, I'd say there's no deadline as such, but beyond 5 to 7 days after taking medications, home prescription, I would say that it's always more prudent to visit a specialist to get yourself checked to rule out anything else.
So moving on to our next question, we all know that we are now glued to our phones and social media throughout the day mostly. Though it's an open secret we all know, still I would like to ask this question: does excessive screen time and stress cause headache and migraine?
I'd say the causes and the problems that social media causes are multifactorial, and they are very direct and indirect. Now, what problem does social media cause to our brain? The first problem is it affects our attention span. Because we are used to short content media, we are getting habituated to a shorter span of attention, and we are consuming a lot of media that we are not retaining forward. So that also affects our brain learning cycle. Our brain has a preformed learning circuitry. It's called the Papez circuit. All of that requires memorization, focus, and rote repetition. And all of these things are missing in social media. So that affects not just our attention, it affects our memory. It also overstimulates our reward centers. What social media does is that in a short amount of time, which for the brain is unnatural, it causes a overstimulation of dopamine synthesis. Now that gives a false form of satisfaction which is not sustained, and as we keep continue doing this, our brain gets used to this so-called dopamine high, and as soon as the candidate or the patient or the person is off social media, the brain starts craving more of that short synthesis of dopamine. So social media has multiple myriad effects. It affects your sleep, it causes you to have more stress. Children, young patients are mostly very anxious when it comes, because they're always comparing themselves to others. They're always seeing some things which are not natural, not normal, or something that is always an over exaggeration, and they're always comparing themselves to other people. The anxiety, the nervousness, the competition, or these things are not normal for the brain. Technology has made many things in life easier, but unfortunately this is one of the downsides of technology. My sincere advice regarding social media would be that we should be very deliberate and conscious about how we use social media and how much we use social media. We should always have a time off. That okay, fine, I'm not saying stop social media. Everything has a value in our life. We should always have a time limit, a time stamp, that okay, 10 minutes is my allotted time, stick to 10 minutes. And even once we get into it, we should always know when to come out of it. No social media before bed, at least 2 hours before bed, no social media, no blue screen time. And if you want to connect to people, go and meet them, call them over the phone. I think those are the values that are going down, which are actually beneficial for the brain, rather than whatever applications that we're using on our phones.
তো দর্শক বন্ধুরা, আপনারা বুঝতে পারলেন যে সোশ্যাল মিডিয়ার অতিরিক্ত ব্যবহার কিন্তু আমাদের এই মাইগ্রেন বা হেডেকের দিকে নিয়ে যেতে পারে। আপনারা রুবি জেনারেল হসপিটালের পর্দায় রুবির হসপিটালের পডকাস্টগুলি দেখবেন, কিন্তু সেটাও টাইম মেনে, যাতে আপনাদের ক্ষতি আপনারা অজান্তেই ডেকে না আনেন। স্যার, the next topic I would like to delve in is dementia. It's a very sad thing that happens to our elderly people, and dementia, what I feel personally, though it's a clinical symptom, but more of it is a social hazard as well, because the people who suffer from dementia has to go to a lot of social stigmatization, social repulsion also from their own loved ones, from their own family members as well. তো আমি এবারে একটু ডিমেনশিয়া নিয়ে কথা বলবো। স্যার, what can be an early sign of dementia in an individual? How to get to know that I'm slowly advancing towards dementia?
Okay, now dementia is definitely a very important topic that we need to deal with. We have to first understand the diagnosis of dementia. Most of the social media, all the cultures that we see in movies or in serials that depict that dementia is forgetting names, or forgetting your keys, or forgetting your mobile phone, or forgetting a phone number. That is not, unfortunately, that is not dementia. We need to be worried about dementia or get ourselves checked when we are forgetting our routine daily activities that we've been doing for years. For example, if we get lost in our own house. For example, if we forget the name of our wife or our father or our mother. Regular daily rote memory activities that we're doing. We forget to button our shirts, we forget to wear our clothes, we forget to knot our tie. These daily, the symptoms that affect your daily lifestyle, if that suddenly changes, that is more of a risk factor that we might be more predisposed to dementia. And more than you yourself thinking of dementia, it is more concerning when your family member says that there is something changing in your habits. It is mostly significant when a family member or a close relative like your father, mother, or your spouse or your sibling comes and tells you that there's something happening. That is more concerning, and that is when we should get ourselves checked regarding this disease. And as usual, prevention of dementia, very important. Stop smoking, take care of your blood pressure, healthy diet, omega-3 fatty acids, 30 to 40 minutes of brisk walk, no excessive gymming, no excessive cardiovascular. A simple brisk walk daily goes a long way, you cannot imagine, in preventing almost all diseases like dementia and stroke. And definitely 7 to 9 hours of uninterrupted deep sleep.
So you have already highlighted like how can we prevent ourselves from getting into this disease. So I would like to ask you very specifically that if we follow these parameters, like as you said, a brisk walking, no smoking, some kind of daily physical exercises, can dementia be prevented or can it be delayed?
Definitely, yeah, it can be prevented, and even with patients who have a genetic predisposition to dementia, for example, Alzheimer's disease or Lewy body dementias, if these factors are tightly controlled, we can prevent this disease from starting by more than a decade or so. And even if the disease has been diagnosed, it can halt or significantly retard the progression of this disease.
তার মানে আমরা জানতে পারলাম যে এই যে ডিমেনশিয়া নামক যে একটা ভয়াবহ রোগ, যেটা আমাদের সমাজে হয়তো খুব তাড়াতাড়ি ছড়িয়ে পড়ছে এবং বহু মাত্রায় ছড়িয়ে পড়ছে, এই ডিমেনশিয়া কিন্তু প্রিভেন্ট করা এবং সেই ডিমেনশিয়াকে স্থগিত রাখা যায় আমরা যদি সঠিকভাবে, ডাক্তারবাবু যেমনটা বললেন, সেই পন্থাগুলো যদি অবলম্বন করি, তাহলে কিন্তু আমরা ডিমেনশিয়া থেকেও আমাদেরও বাঁচাতে পারবো এবং আমাদের, বিশেষ করে আমাদের বাড়িতে যারা বয়স্ক মানুষেরা আছেন তাদের ক্ষেত্রে কিন্তু বিশেষভাবে এই পন্থাগুলি অবলম্বন করলে আমরা ডিমেনশিয়া থেকে অনেকটাই দূরে থাকতে পারবো। স্যার, আই উড লাইক টু মুভ ইন আ নেক্সট টপিক, দ্যাট ইজ স্লিপ। Again, the social media bandwagon says that you need to hustle 24/7. The corporate cultures that are coming up, they are emphasizing more that less of me time, more of time at office. So, trailing to this topic, I would like to ask the first question, like, why is sleep so important for brain health?
Sleep is the most important activity for the brain, because it is only during sleep that a brain actually gets to recover. The brain is a culmination of millions of neurons and gap junctions, electrical synapses. It is only during sleep when they get to replenish their neurochemical hormone. They get to excrete their metabolites and excretory products. This is the time when all the hormones like melatonin are secreted. Our stress hormones like cortisol are downregulated. Our anti-stress hormones like enkephalins, dopamine, serotonin are naturally upregulated during sleep. It controls our circadian rhythm. It is necessary, essential for our body's repair, our growth, our DNA multiplication, our DNA repair, for our longevity. I cannot emphasize how important an interrupted 7 to 9 hours of good sleep is. More than the amount of sleep, what is important is the quality of sleep. That is why we keep saying that technology has an important role in our lives, but overuse of anything in life is not good. Coffee should be regulated. Social media should be regulated. No coffee beyond 6 p.m. No social media less than 2 hours from bedtime. And obviously, we should avoid using the phone, the iPad, blue screens. They all have deleterious effect. They affect your sleep. So, for the brain, sleep is a mandatory ritual. It is like the most important, there's no other way to say it, the most important factor affecting your brain health is sleep.
So would you like to set a benchmark, like an ideal threshold level up to which we should sleep in a day, or we should maintain that amount of sleep in a day?
It depends from person to person. There is not one value as per science, but the range is pre-decided. It is between 7 to 9 hours. It changes depending on the age and the gender of the person, but 7 to 9 hours of quality sleep, uninterrupted, that is important.
But sir, as I was just highlighting that it's 2026 and we are all running. We don't know after which we are running, after what we are running, but we are running in some sort of, in some way or the other. So sir, the major side effect or the after effect of this endless running is a hampered sleep. So sir, what is your advice for people who struggle with sleep? How can they modify their lifestyle to have a good sound sleep, as you said, of minimum 7 to 9 hours per day?
As with most other things in life, we have to be conscious about it. We have to address the problem at its root. We have to first accept the fact that we are dealing with insomnia. We need to look for reasons that could affect our sleep, and we need to actively address these problems. Whether is it some societal pressure, is it some peer pressure, any stresses at work, any other, it's a very personal problem. It's not always a medical problem. These things need to be issued, and obviously the general things that I said, a little bit of exercise goes a very long way when it comes to sleep. And coffee, cut down on coffee, cut down on tobacco, cut down on stimulants after 6 p.m. and cut down the blue screen. These things, it's basically it's a multi-parametric effect, and over a period of time these things will make a difference in the quality of sleep. And whenever a patient sees that even after all these changes in their lifestyle, they are still not able to hit their daily target, they should visit a specialist.
So you have already highlighted several times in this podcast that range till what we have spoken, that the bad sides of social media, like how social media is impacting our entire this brain system, the entire nervous system in our body. So I would like to ask you very specifically, like how social media is changing the brain and its functioning, like what it used to be some years ago when social media wasn't a thing, and how it is changing now with the advent of social media, how the daily day-to-day functioning of brain is getting changed or affected due to this overusage of social media.
Social media primarily targets 3 centers of our brain, which causes the problems that it is causing these days. Number 1, attention. Number 2, memory. Number 3, the reward punishment system. Attention is getting shorter, as I've previously discussed, because we are more used to short forms of social media, the reel that these people these days they speak of. So the brain is getting used to having short attention spans, and the brain is something that the way you train it, the brain pretty much becomes that. Memory is also going because we consume so much of media and we hardly remember anything of it. If you ask a person what reels did you go through yesterday, I'm sure the person won't even be able to remember more than 3 or 4 the significant ones. So because the brain is used to repetition, rote memory, repetition, and things staying in their attention for a longer period of time, for this neurological circuitry to form to retain those memories, we are not giving the brain that much time. So the brain is getting used to forgetting things. For the brain now, it's okay to consume something and to just forget it the next second. The brain now thinks it's okay to not remember things, and the brain will do what you teach your brain or you make your brain habituated to. That is the second downside. And as I've said, the third most important downside is the artificial dopamine highs that we are getting. The dopamine is a hormone that initially it's supposed to come out, it's supposed to be excessively secreted after real gratification. Getting good marks in your school, getting 100% attendance register, graduating from college, having your first child, your spouse's anniversary. Those were previously the triggers for that dopamine high that made us happy, or maybe Durga Puja or meeting our family after 1 year. But now people are getting that dopamine stimulation sitting at home with a cell phone, sitting in the bathroom, sitting on the bed on a simple 5-second reel. The brain does not know, and the brain will get used to those short dopamine spikes. And the effect of the dopamine spike is that the more dopamine spikes we have, the more tachyphylactic we become to it, the more insensitive that dopamine we become to. So now the brain wants more. The brain wants more of that feel good factor. So what does the patient do? More social media, a little bit more dopamine, and the cycle, it's a vicious cycle. It keeps continuing on, and the brain keeps asking for that high, and you always have a shortcut to it. So this entire triad, this dangerous triad of short attention span, lack of memory, and the abuse of our brain's natural reward punishment cycle, these three things lead to anxiety, depression, it leads to stress, and even if inevitably all these lead to less sleep, more work pressure, less of a decent mental state, euphoria, depression, all the factors that we are seeing these days in children, in young subjects, it's all because of these problems that we are facing.
So, sir, another very highlighting concept that we are coming across is healthy screen time. So, sir, I would like to ask you that is healthy screen time a utopian concept or something like that does really exist? And even if it is so, like a healthy screen time, what we should consider under to be a healthy screen time? I would ask specifically for both children and adults.
Okay. Now, there is no study, there's no meta-analysis that can quantify screen time to be healthy or unhealthy. We have to look at this topic in a different perspective. Screen time justified for education, for work, for advancing a skill is healthy screen time. Screen time without being deliberate about it, without being conscious about it, is an unhealthy screen time. If you're learning a skill, for example, if you're learning to play the guitar, you can take a 1 hour online course. That is completely healthy. But if you're just randomly scrolling on social media, I'd say even more than 10 minutes is not going to help you. It's actually going to damage you. So more than the time, it is the deliberate act of it and where you are spending that screen time that is important. But as a general rule, I'd say 2 hours from sleep, no screen time, and more than 15 minutes on doing nothing and just scrolling is unhealthy, and even more so for children than adults.
তার মানে দর্শক বন্ধুরা, ডাক্তারবাবু যেমনটা আমাদের জানালেন যে এই যে সোশ্যাল মিডিয়া এবং আমাদের মোবাইল ফোনে এই যে অবিরত আমাদের এই যে বুড়ো আঙুলের ইশারায় যে আমরা এই যে সমানে রিল দেখে যাই, সেটি অজান্তেই আমাদের ব্রেনের কতটা ক্ষতি করছে এবং সেই থেকে কিভাবে আমরা বিরত থাকব, এবং এই যে স্ক্রিন টাইমটা, যেটার কথা ডাক্তারবাবু বললেন, স্ক্রিন টাইমটা আমরা কিভাবে আনহেলদি থেকে হেলদিভাবে ইউজ করতে পারি, সেটার কথাও কিন্তু আজকে এই আলোচনায় উঠে এলো। আশা করি আপনারা সেটি ফলো করেছেন। স্যার, আই উড মুভ অন টু অ্যানাদার ডিফারেন্ট অ্যাসপেক্ট নাও, দ্যাট ইজ neurosurgery and common myths. Generally, people have a very fearful idea about brain surgery. It's like next to death. Like a patient undergoing a brain surgery, they assume it without any underlying facts that it's a great thing, but a patient might not come back from the OT table. So, sir, what are the most common misconceptions that people have regarding the brain surgeries and surgeries related to your area of practice?
The less we know about a topic, the more we are afraid of it. So this is a bit like that, but neurosurgery has come a very, very long way since the last 20-30 years. Sometimes the less we know about a subject, the more afraid we are of it, and this comes in that criterion. Neurosurgery has taken multiple leaps and bounds in the last 30-40 years with advanced technique like MRI, CTs, PET scans, neuronavigation, C-arms, O-arms, image-guided resection surgeries, and immunofluorescent dye-guided surgeries. We are able to specifically target on a millimetric, on a microscopic basis, the exact point in the brain where the disease is, and deal with it without causing any damage to the surrounding structures. It is a myth that neurosurgery leads to neurological deficits or paralysis. It used to happen, I do agree, but that was 50-60 years back. Now these things are a thing of the past and neurosurgery is completely safe.
So, sir, I think you ascertain on this fact that what the scenario was 20 years back, now the scenario has changed remarkably in the field of neurosurgery. আর দর্শক বন্ধুরা, আপনারাও বুঝতে পারলেন যে আমাদের যেটা ধারণা ছিল, সেই ধারণাটা হয়তো 70-এর দশকে সেইটা হয়তো সেই ধারণার বশবর্তী হয়ে আমরা চলতে পারতাম, কিন্তু 2026-এ দাঁড়িয়ে ডাক্তারবাবু যে ক্লিনিক্যাল অ্যাডভান্সমেন্টসগুলোর কথা বললেন, এত রকম ক্লিনিক্যাল অ্যাডভান্সমেন্ট হয়েছে, মেডিকেল সায়েন্স এত এগিয়ে গেছে, আমাদের যে ধারণাগুলো ছিল, যে ভয় ভীতিগুলো ছিল, সেইগুলো কিন্তু আর 2026-এ দাঁড়িয়ে সেগুলোর আর অস্তিত্ব রাখে না, ডাক্তারবাবু যেমনটা বললেন। ডক্টর সিং, থ্যাংক ইউ সো মাচ ফর সাচ অ্যান এনরিচিং ডিসকাশন। দর্শক বন্ধুরা, আপনারা নিশ্চয়ই এই আলোচনার দ্বারা ভীষণভাবে সমৃদ্ধ হয়েছেন। আমরা তো প্রত্যেকেই যারা এই পডকাস্টটি শুনলাম, ডক্টর বিপ্লব সিং আমাদের এত সুন্দর করে, এত ডিটেলসে আমাদের বোঝার মতো করে সব কিছু এত সুন্দর করে বুঝিয়ে দিলেন। আশা করি আপনাদের আমাদের এই ব্রেন এবং তার ব্রেনের সুস্থতা নিয়ে যা যা যাবতীয় সঠিক ধারণা, ভ্রান্ত ধারণা ছিল, সব কিছুর সেইগুলোর আরও বেটার আপনারা দিক নির্দেশ পেয়েছেন। আগেন আই উড লাইক টু থ্যাংক ডক্টর সিং ভেরি মাচ।
থ্যাংক ইউ।
আমরা বুঝতে পারলাম ডক্টর সিং যেমনটা বললেন যে সঠিক জীবনচর্চা, হেলদি লাইফস্টাইল, স্মোকিং থেকে বিরত থাকা, সঠিক এক্সারসাইজ এবং সঠিক সময়ে সঠিক সিমটম আইডেন্টিফাই করে ডাক্তারবাবুদের সাহায্য নেওয়া, এই সব কিছু, এই প্যারামিটারগুলো যদি আমরা মেনে চলতে পারি, তাহলে কিন্তু আমরা যেরকমভাবে চিরকাল আমাদের মগজাস্ত্র নিয়ে গর্ব করেছি, সেই রকমভাবে আগামী দিনেও সেই মগজাস্ত্রের জোরে কিন্তু আমরা বিশ্বজয় করতে পারি। এবং এই পথে রুবি জেনারেল হসপিটাল এবং রুবি ক্যান্সার সেন্টারও সর্বদা আপনাদের সঙ্গে আছেন। আমাদের হসপিটালে বিশিষ্ট চিকিৎসকেরা রয়েছেন, যারা আপনাদের শরীরে নানান ধরনের এই যে সমস্যা যদি আপনারা রেগুলার সম্মুখীন হচ্ছেন, সেগুলো থেকে কি করে বেরিয়ে আসবেন বা কি করে সেগুলোকে প্রিভেন্ট করবেন, আপনারা যদি বুঝতে না পারেন বা চাইছেন আরও এক্সপার্ট সাজেশনে, তাহলে রুবি জেনারেল হসপিটাল এবং রুবি ক্যান্সার সেন্টারের দরজা আপনাদের জন্য সর্বদা খোলা। আমরা প্রতিনিয়ত রয়েছি আপনাদের সেবায়, আপনাদের সাহায্যে। সকলকে অনেক ধন্যবাদ। নমস্কার।